Welcome to the Bite Podcast, episode 12. We've got Lisa here today. Obviously, I want you to say everything and tell me who you are and what you're about. I know who you are. And
I am not even sure what I'm about sometimes. So my name's Lisa. I have been a NICU nurse, pediatric nurse for going on 20 years now, which makes me feel super old. I have worked...
You don't look it at all?
I do, I feel it. I have worked in and out of the GCC since 2010, Saudi, Qatar, here. When we moved here 3.5 years ago now, 3.5 years, I knew I did not want to go back into the hospitals because been there, done that. I needed something a bit more flexible because of my son. And so I set up Lullabies, basically because I got a bit bored at home. Once I had done all of the snagging that anyone that lives in Dubai that gets a rental house knows, you have to completely fix it.
Yeah.
So once that was done, I thought, what can I do? And it seemed like an absolute waste not to do something with that many years experience with mums, dads and babies in what is to them some of the worst periods of their life. And it just felt like a waste not to use that. So I set up Lullabies, started with sleep coaching, very quickly moved on to lactation consulting, then baby massage. Now I do first aid awareness, I do antenatal classes, I do nanny training.
Where did you find this time to do it now? Or is this your full-time thing now?
Well, this in May, we finally got a nanny because I was just dying. And I had all these conversations in my head about why I needed a nanny because we'd never had one before and my son's 5. And my poor husband, one day I was just like, right, so I have booked a nanny for next month and he's like, whoa, sorry, what? Because I'd had all these conversations in my own head about how a nanny would make our lives better, but neglected to have any of them with him. So we got a part-time nanny at that point, legally, I will add, through an agency. Yes. And then we graduated to full-time and she gave me all this time back in my life, which I've now filled. Yeah. Now I have no time again.
Wow.
Lullabies soft launched in February 2023, I think. I'm not even sure.
Yeah.
I see all these things on Instagram and people are like, it's our 1 year, it's our 2 year. And I'm like, I don't even know. Really since like February 2023.
What is your favorite thing to do?
Honestly, and people at home, nurses that I've worked with would literally kill themselves laughing if I say it's the lactation consulting.
Yeah.
And I think that comes from years and years in the NICU and working with the parents and troubleshooting and honestly, making them feel like their baby is theirs. Because in the NICU, so much of that is taken away.
Yeah. And
I always felt like it was my job to give them that back and help them get to know their baby, how best to deal with their baby, recognize their baby's cues, etc., etc., etc. However, a very close second is the nanny training because all the jobs I did in nursing, I mean, I had like clinical to quality improvement and everything in between. Yeah. I loved my education, my practice education and my clinical educator role the best. And I've really missed that aspect of taking someone and helping them to grow and just helping them literally, as cheesy as it sounds, be like the best they can be. So the two run very closely hand in hand.
There was something that you did, I think, a week or two ago. It was the impact on the infant's oral health.
Okay.
Please, I really want to speak about that. It was from the latching. Obviously, I don't know much about it, but please.
So in terms, there's a couple of things I look at oral health-wise with baby. And the first one, yes, absolutely, is the latching. Yeah. That has much more of an impact on the mum than the baby. Okay. Because obviously if the baby has a really poor latch, mum is going to be sore, she's going to be broken quite literally, and breastfeeding often will stop in that instance. So lactation education starts before the baby is born. Okay. Most of the mums that I see prior have much more, not successful, because I never like to use that word, but they have a longer and a happier breastfeeding journey than those that I don't, because they kind of know what to expect. And they know that if something happens, okay, I'm going to give Lisa a buzz. Yeah. Sometimes all I need is 5 minutes and I can fix it. Okay. So first and foremost, it has quite a big effect on the mum. If you have got an infant with a poor latch as well, it can also affect them because it can make them really gassy. And if you've got, they're bringing in all the air. And if you have got a baby with a poor latch, then the mum, if she doesn't see a lactation consultant or a pediatrician with an interest in breastfeeding, then she's more likely to discontinue. So that baby will then go onto a bottle, most likely. I have nothing against bottles and formulas, let me just put that out there. Everything has its place. She will be most likely to discontinue, and then you've got the bottles, the night feeding, etc. And the way the bottle works, the formula kind of washes the teeth and the gums and pulls, and you're more likely to have issues with cavities, etc., oral health issues with a bottle than you are with breastfeeding. It's biology.
So when, because I don't have any children or anything like that, when you don't
Good choice. I love my son. Just turns out there.
When you don't breastfeed, do you still have to pump it all out, or does it just evaporate, or what?
It just goes. It just goes. If for whatever reason you decide you're not going to breastfeed, and women have multiple reasons. There could be medication involved that they are unable to breastfeed with. They could just not want to. There could be trauma, anything. Whatever the reason is that you decide and you've had all the information and you made an informed decision, then the breast milk will just go. It will come in, and you will still have kind of all the engorgement and pain and everything associated with those first few days, but then gradually it will go. There are things that we can do to help it go and ease the discomfort, but if you never start, then it will just go. But you do have to ease that discomfort, because you can still get things like mastitis.
Oh, shame. I get asked this a lot, but again, I'm not a mom. I haven't spoken to one of you guys yet. What is the ideal? I never like saying it, because it's mom to mom, situation to situation. Let's just put a number to it. What's the ideal time for breastfeeding? Because I spoke to an oncologist, and he said the longer you breastfeed, obviously according to time, you are less prone to breast cancer.
Yes, so I'm guessing here you don't mind how often should a feed be, or how long, but the overall time.
Yes, sorry.
So, World Health Organization, up to 2 years is considered
normal.
Great, cool. Absolutely biologically normal. Now, there are some theories out there about milk teeth, and it's when the milk teeth fall out, and that's why they're called milk teeth. So actually, self-weaning and breastfeeding is biologically normal up to age 5 to 7. Now,
wow.
That would never have been a thing for me, but I was very fortunate in that my son self-weaned at 1. Just all of a sudden, he decided, okay, I'm not interested in this anymore. So there are definitely some people that think 5 to 7 is biologically normal.
Yeah, I have a person in my life whose kid is 6 now, and he's still breastfeeding.
And great. If that is their thing, then absolutely great. If mum and baby/child are happy, then that is all that matters. I mean, there's definitely still benefits. You've got all of the antibodies, etc., to kind of help with baby's overall health. So we already know all the things it does for babies, right?
Yeah.
But often, so one thing I always ask in my antenatal class, before I put this slide up, is what are the benefits for mum? And the one that always comes up is weight loss. Always. Yeah. And I would just like to say, you only have weight loss if you don't eat a cookie every time you breastfeed, because it's good for your milk. Not guilty, maybe. I like that. But yeah, I kept some cookies beside the bed every night feed. I would have an oat cookie, because oats are good for your milk. But most people in the kind of Western culture, most will breastfeed up to 6 months a year, okay? In cultures where the maternity leave is really poor, so America, for example, we all know about that.
Yeah.
Mums are sleep training and pumping exclusively for after the first 6 weeks. But the longer a mother breastfeeds, the more it decreases the risk of osteoporosis, breast cancer, cervical cancer, diabetes, and there's a few other things as well. It's crazy. Well, for every extra month you breastfeed, your chance at this decreases. Yeah.
What's the tool someone can have for effective breastfeeding? I'm sorry that I'm just going into it.
It's okay.
I honestly get people that walk in and they start chatting to me, and obviously I want to see how they're doing, and the bubba's there, because obviously my niche is pregnancy.
Yeah.
I want everyone to come see me for the oral health reasons, and they ask me every single time, do you know anyone that I can recommend? So please, effective breastfeeding.
So effective breastfeeding, honestly, I see a lactation consultant, and I never, ever, it might not be me. I am not for everyone, and that's fine. Marmite, right? See someone you gel with, okay? Because you are more likely to succeed. okay? And again, there's that word succeed. Whatever you manage, you have succeeded.
Yeah.
Because it's what you manage. There's no failing in
I like
pregnancy.
the fact that you said it like that.
Yes. There's no failing in pregnancy and childhood. As long as what you're doing is safe, have at it.
Lovely.
But if you can, see a lactation consultant antenatally, just because they can then prep you for everything.
When would they start wanting to see you or get introduced to you?
I see people from about 34 weeks.
Okay, cool. Yeah.
In the antenatal class, we say from like 30 weeks plus, because otherwise by the time they're hitting the end of our 4-week course, they're so uncomfortable. So the midwife I do my antenatal classes with, Nikki, she was telling everybody to come from 32 weeks, and I kept having women that were missing the last class because they'd had the baby. So I'm like, we need to say 30 weeks. But for just solely an antenatal session, I say from about 34, 35 weeks.
Okay.
I'm seeing someone this week who's much earlier, but that's because we know that the baby is going to be delivered at 34 weeks.
Okay.
So if you can beforehand, do it.
Yeah.
The first sign of trouble, or you think that something is not right, give us a call. Because often we can just change things, a slight tweak in positioning.
Yeah.
You know, we can just say in 5 minutes, let's try this, see what happens. So I think
that's perfect.
For me, that is not just about breastfeeding, and you'll notice that I was really careful not to put that in that one because that's one of mine. It's showing up in whatever format you are able to. If you are breastfeeding round the clock, you're breastfeeding round the clock and you're there. From a dad's perspective, they are showing up more for the mum. So I always say at the antenatal classes, your job is to feed baby. If that's the route you decide to go down breastfeeding, everyone else's job is to feed you. They need to show up for you while you are showing up for the baby, because indirectly they're then showing up for the baby. Yeah. So however you choose to feed your baby, in those early days, it can be stressful. It can be the most lovely thing in the world, but it can also be extremely stressful and exhausting. And no matter how many antenatal classes you take, nothing can prepare you for that.
Sleep exhaustion, not eating right. They look exhausted when they walk into my surgery. I feel so bad. There's nothing I can do except you've got to.
They come to my baby massage class and they look amazing. I'm like, I don't even look like that 5 years postpartum. Like, honestly, these mums in Dubai, I'm just like, however, I do a well baby clinic with Mama Hub once a month. It's like a free well baby clinic on the last Friday of the month. It's lovely. Yeah. And one mum came once and she's like, it's the first time I've come out with the baby by myself. Yeah. And she's like, and I was really worried that it was going to be like everybody immaculate. And at this point I'm in leggings and a baggy t-shirt. And so was Rachel. And I don't think Emma was there at this one, but we were just like, we are not a fancy. Yeah. The Mama Hub playgroup is turn up as you are. If you want to come in full makeup, lovely. If you want to come with your hair in a mum bun, lovely.
So what is it? So it's like
they do a morning session playgroup. It's very minimally priced because in Dubai everything is so expensive. Yeah. And then once a month, so it's their playgroup and they just host me once a month. And it's lovely. I just pitch up. It's a lovely way to end the month on a Friday morning. Pitch up, have coffee with these lovely ladies that run it and talk to some mums. Lovely. Occasionally weigh some babies. Yeah. But talk to some mums. That's my main thing.
Is there any food you recommend after childbirth? Like in that time where you're busy breastfeeding and you're trying to, because obviously the brain's not right, the body's obviously giving all to the baby. Yeah. You are letting yourself down, inverted commas, not really, but you know what I mean? Is there anything you recommend?
So there's a few things. We are fortunate in that we live in Dubai.
Yes.
And whatever you want, you can throw money at it.
Yeah.
So there's a few things I advise mums to do if the budget allows. Number one, so in the UK we would say batch cooking, right? I'll be honest, I batch cooked like a demon and I hardly used any of it. But in Dubai, you've obviously got Deliveroo. Yeah. It does not have to be a burger. It can be a salad, you know, as long as you've got your proteins in. So high protein, good fats, good carbs, and just think about what you are putting in your body and high in nutrients. And so many mums I see, myself included, after I was postnatal, because they made me feel really sick, don't take their vitamins and things after.
I've seen that as well.
And the body takes everything from you to give to the baby. So it is so important that you do that, says she who did not. But it's so important. And there's meal plans out here for mums specifically for their requirements.
Oh, okay. I didn't know that.
Yeah, we used to think that the body only needed about 500 calories extra a day if they were breastfeeding. A very recent study has suggested, I want to say like 12 to 1500 calories more. Extra. So we used to say like 2 slices of toast was enough. Yeah. 2 nice slices of sourdough was enough. But actually, I mean, have 4 slices if you want, but give yourself a break. It took 9 months to have that baby.
Wow.
It's going to take 9 months to lose everything. And I actually feel sorry for not sorry, but I really feel for quite a lot of Dubai mums, because I feel like there is this absolute pressure in this country to look your best, especially if you are, for example, an influencer. And I just think the pressure these women must feel to kind of bounce back.
How long does it take for your body to bounce back? That's actually a common question as well.
A year after you finish breastfeeding.
It's a year. I was told 2 years, but it's exactly a year after.
Different opinions, but I've always been taught it's a year.
Wow.
So one of the hormones that comes into your body when you're pregnant is elastin. And that is exactly as it sounds. That's what helps the body stretch, which it needs to do. Okay. And while you're breastfeeding, that's still knocking around in there. Yeah. And one of my really good friends is desperate for a boob job. And I was like, just wait, give it a year until you finish, because actually they're never going to be the same as they were, but a lot more of that fullness and things will come back.
Oh, wow.
So, and you feel, I literally felt it pretty much a year after I stopped, because my husband gives me big bear hugs and cracks my back.
Yeah.
And from the minute I was pregnant, my back wouldn't crack until about a year, like 13, 14 months after I stopped breastfeeding, I cracked my back and I was like, okay, everything's back to normal.
Back to normal.
Yeah, it was really bizarre. So roughly a year to 18 months.
Sleep training, how do you feel, especially because, again, like I said, like before, there's parents that actually, walk into my surgery, they're exhausted, but they're like, I haven't slept in 2-3 days. What type of guilt do they have? Like sleep and guilt, like how can we overcome it? What can we as clinicians?
I don't think you ever can. I think it's acknowledgement. And I think that society places so much guilt on mothers. And I said it this morning at baby massage class. I'm like, society places so much on us. Don't put any more on yourself.
Yeah.
But it's inherent. I was in Saudi last week for Baby Expo, and I felt really guilty that I didn't take my 5-year-old, because I saw one of my friends, fine when her kids weren't there, but as soon as her kids were there, who he just loves playing with, I just felt so much guilt. And I'm not a big believer in mum guilt, but society programs us to feel like that. And the thing with breastfeeding and sleep and things like that, breastfeeding especially, it's a relationship. And the relationship has to work for both of you. Yeah. I don't believe in detriment to either party.
Yeah.
So we figure out a way that benefits both mum and baby, that mum is as comfortable as she's going to be. So I just feel like we look at things in isolation when actually we need to look at everything that's going on. And with sleep, I don't touch babies till they're about 5.5 to 6 months. I am moving away from calling myself gentle, because parents assume that gentle means not crying. Babies communicate by crying. Babies are not manipulative, okay? Yeah. They cannot manipulate you. They do not have that in them. Yeah. But what they know is, okay, so last time I did this, she did this. And a baby wants what they want. And they know what works. Now, in an adult, that would be called manipulation. Mm-hmm. But in a child, they don't have it in them till they're about 4 or 5-ish. They just don't.
Are you allowed to have your baby like crying for like 15 minutes, but if they don't need it, if you've fed them, if you've changed them, if you've done everything and you want them to sleep?
So that would be more of a modified Ferber type approach, which I only do on request. And that was created for the American market because they go back to work so quickly.
Yes.
Like these mums, it's 6 weeks. I didn't even know my own name, let alone go back to work and be a CEO or whatever in a multinational company. I mean, I would be like, the company would fail.
Yeah.
But so that is an older type of sleep coaching.
Okay.
So I don't work with the baby, I work with the parents, and the parents do all of it. And I view myself as like their online kind of cheerleader, if you like, their virtual cheerleader. I was on the phone for 35 minutes to a family in the car on the way up here, because that's part of it. Parents need different things. And so my aim is to take away the reliance on the parents for sleep, but never the need. A child should always need its parents, but the reliance should go. So we swap things out and we go very slowly down specific steps in order to get the baby and the parents where they're happy. So I don't tend to do in the room, out the room, in the room, out the room. That's an older kind of style, I guess.
Yeah. So when you have like your courses or your training, do moms actually come in and say, I've got yellow teeth, I've got sensitivity, everything's brittle in my mouth? Do they actually pinpoint it, or is it more like a...
Usually, because I see them early on.
Okay.
So bear in mind, with the antenatal and the baby massage and the immediate postnatal period, I see them later on. The ones that do mention anything like that are the ones, because I see them, and then I might like comment something in a mum's group and they're like, oh yeah, blah, blah, blah. Or I see them out and we have a little chat.
Yeah.
But it's the ones that come to me at like 18 months, 24 months, and they're like, I am ready to wean now. Like, I want myself back, but I don't know how to do it. So they're the ones that tend to speak a little bit more about that. And that's the thing with both sleep coaching and weaning from the breast. When the child is younger, and I'm sure I'll get slated for this, but when the child is younger, you can pretty much just do stuff to them because they're younger. When they hit about 14 months plus, you're involving them in the process. And there's some great play therapists out there, and play therapy is finally coming to the UK. As a nurse, I absolutely know the benefits of play therapy for children. And it's finally coming in. There's a new centre that's opened recently. I can't remember what it's called, but there's a new like kind of play therapy centre. And a lot of what I do is based on play and books and preparation, because that's how children learn.
Yeah.
So the mums tend to get into it with me then at that point, but not in the early days.
Is there any top tips or anything that you can leave our moms on this platform?
Take your vitamins. Take your vitamins. Is there any that I wish someone had told me? To be honest, probably no, but that's only because I was a NICU nurse for years. So I was used to the sleeplessness, I was used to night shifts, I was used to all that. But what I would say to most new mums is have the confidence in yourself, because nobody knows your baby better than you.
Yeah.
Yes, I'm coming in as the lactation consultant. Yes, I'm coming in as the sleep coach. I know your baby from that hour, and I know what has worked for thousands of babies probably prior to that, but you know your baby.
I love that.
You know if they're crying through hunger, you know if they're crying through pain with teething or something like that. You know your baby best. That, and be prepared to merge into your sofa if you are breastfeeding.
Thank you.
Because you will just constantly, one of my friends said she felt like she was getting a DVT, because you are just constantly feeding the baby, and it's everyone else's job to feed you.
I love that. Thank you so much for your time and being on this podcast and giving a little bit of information here and there. Thank you.